Hey guys, Elon Musk is in news and a lot of people want to know how he got a transplant and how much did it cost to him and how is he maintaining his hair at this age. So I am your friend Dr. Shaill Gupta, Satya Pranam. I am a hair transplant surgeon and I have been doing surgeries for almost 20 years now. Now, as far as Elon Musk is concerned, he is one of the greatest men Earth has ever produced, and he's one of my idols. And amazing guy, amazing vision with all that crazy stuff he does. But that's amazing, out of the world, out of the box thinking. So he has this journey. I mean, he has lived this journey, and at this age now, when we see him, he still has good hair. But the things were not same at the. If you see this picture, when he was associated with PayPal, and if you see, this is like 1999. So that was uh, almost 23 years back, and we can see the hairline is quite receded, though he seemed to be having good hair at the back, at the top crown, but the frontal area had really thinned out. Now, uh, if we see this picture now, he has a definite hairline, though this is not the one which we usually see these days. So that was a little higher hairline which he got done, and he probably got a transplant done in somewhere around 2001 or 2, and we can see that he has a strip line, and at that point of time FUE procedure was also not very popular. And Elon Musk is obviously one of the richest men on the planet, and in fact he is the richest man now. So he could have done anything and everything to his hair, and he chose FUT surgery. At that point of time, probably there was no other option as well. So we can see the hair look good, and we don't know whether he took medication at that point of time or not. Things went on pretty well with him, and he seemed to sustain those hair for a good period of time till he went for the other procedure which he underwent maybe around 2008 or 2009. And again this was an FUT procedure, because if you see, with very short hair, we can see a small faint outline of the scar stitch line, though it is not very prominent. And if he grows hair, which he does these days, it doesn't look very obviously visible. Now another surgery, another FUT surgery. At this point of time, we were doing FUE also, and FUE had really come big way. But a man of Elon Musk's stature opted for FUT again. Don't you think that he must have done his research? Maybe anything or everything under the planet. Yes, he must have done that. But again, he chose FUT. There must have been some reason. Some reason why he chose FUT again. Now, with this procedure, he got a lower hairline, slightly thicker, he got a better shape. And there are important lessons which you can learn from Elon Musk's hair transplant. One, he is around 50 years of age and he's still retaining those hair. He opted for FUT surgery. He could have opted for anything. The advantage which FUT surgery gives us is we get hair from the safe donor zone. So you know that there are two areas like safe zone, unsafe zone. When we cut a strip from the safe donor zone, these grafts are the ones which are going to last longer than the grafts taken from unsafe safe zone, which is little high or little low. So when, I think in his case, though we don't know the exact numbers, but combined first and second surgery, the number should be somewhere around 3,500 to 4,000 grafts, which is a good number. To do that many grafts by FUE would have definitely depleted the donor area. And when we extract that many grafts, we have to make use of unsafe donor zone, or we have to over harvest. Now this is going to create problems, because grafts extracted from unsafe donor zone are not going to stay for a long period of time. These grafts are going to, thin out or fall in very short period. So this is very important. Now, and the donor also gets completely depleted if we do 2 consecutive sessions of FUE. Uh, Obviously, FUT can be done twice or sometimes even thrice if the elasticity of skin allows us to do so. And again, that is a big advantage in progressive baldness. He still has a very good donor at the back of his head, and if he wants, he can go for another FUT or FUE still. Suppose we got 4,000 grafts from maybe this much thick 2 strips, okay, maybe around 1 centimeter wide, 1 centimeter thick strip, both the times, first and second surgery. That makes it around an area of 2 centimeter and the length of the strip. And now we have got all the hair which were present in that area, and we end up having a very thin line because of trichophytic closure. Now, had we done FUE, and suppose if we had taken all the 4,000 grafts present in that area, how would that area have looked like? Completely empty and not possible. So the longevity of the result obviously depends on the graft extraction from safe and unsafe donor zone, which is very important. I've made a lot of videos about safe and unsafe donor zone. In fact, we are running a campaign, Save the Donor campaign, where you get to know the real truth about the safe donor zone, unsafe donor zone. And I really believe that rather than showing flashy results, which are all the same everywhere, no difference. But yes, the difference is very, very prominent. If you have correct information, right information, you can plan your journey the way Elon Musk did it. And he is the role model for us in so many things. Now, another important aspect, which is obviously very important, and people are speculating about it, and they have their own views, though we don't know whether Elon Musk is taking any medication right now, or he took some point down the line. Is he still taking it? We don't know. But yes, let us understand who needs medications after transplantation and how long these medicines keep working. Do they keep working forever? Don't you think 22, 23 years is a big period, big time for those medicines to keep giving effects? Okay, so there is a medicine called minoxidil, commonly known as Rogaine, and Propecia or finasteride, which is usually given at 1 mg per day dosage. Now, uh, across the globe, there is a conception that people say, okay, fine, when we do a transplant, we put the patient on 1 mg finasteride. And that actually makes the hair thicker. It is supposed to prevent further hair loss, and not only it prevents further hair loss, but it also regrows a lot of hair, so that the transplant result also looks amazing and more full. It grows you a lot of softer hair, which can make the hairline look aesthetically more pleasing. But the issue with medicine is dependence. Once you start the medicine, you cannot stop it. The another issue with the medicine is we know the side effects which finasteride can cause, and these side effects include gynecomastia, uh, erectile dysfunction, loss of libido, and so many. So I'm not sure whether a person like Elon Musk uh, would be taking this medicine for so long. Now, what happens if you start the medicine and stop it in between? There is a severe thinning and rebound hair loss, which is much more than the previous hair loss at the point when you started. So you lose two types of hair, one which were regrown by the medicine, and second which would have fallen because of the medicine. And there is another category to this, those hair which would have survived without the medicine also, they also start falling, some of them. So if the medicine grows you 100 new hair, when you stop the medicine, you might see that 200 hair are gone. Okay, so one thing is for sure, that if he started the medication, finasteride I'm talking about, he cannot stop it. So either he did not start it at all, or if he started, he is still continuing, and even after 20-23 years of continuous usage, the medicine is still working on his head. Now that's a big one, because this medicine was given US FDA approval in 1999, and a very good medicine. You will find a lot of literature around this medicine, Propecia or finasteride. But if you see, I mean, you'll hardly find cases where people say, okay, I have been taking this for 20 years and my results are still excellent. I'm not losing hair. So 20 years is a very big time for a person to develop tolerance, very big time. Usually, like in my 20 years of practice, I have seen many patients where we started the medicine and those who actually need it, sometimes they develop tolerance to it also very soon, 3 years, 4 years, 5 years. And there is a big chunk of people who actually don't need the medicine, including myself. I did my transplantation around 2 years back. I am not using any minoxidil or finasteride, and my age is 46, and I'm still retaining a good decent I mean, my hair are good. So now the thing is, there is a probability that Elon Musk did not take any medicine, or maybe used for some time and then stopped it. What I believe, he is not continuously taking the medicine, not right now, because he would have developed tolerance to the medicine by now. Now, not taking a medicine is always in fact better than starting the medicine and then stopping the medicine. So it's a big decision of your life, okay, which you have to make when you go for a transplant, and you have to discuss this in length with your surgeon. If I am operating 100 patients, not all of them need the medicine, including myself. Okay, so that means if you give this medicine and a person is actually taking it for a long period of time, there is very high probability that the thinning goes on and the medicine doesn't keep working the same way it was working. So you have to choose for a patient who is like into his 30s, late 30s or 40s, can afford not to take the medicine. Let it be patient's decision, because if he starts under pressure of surgeon, or because he has a belief system that if he doesn't take, something really bad is going to happen, I think you should be your own judge, and you should take a call, because these hair are borrowed hairs which you get because of the medication, and they are not going to stay there forever. And a lot of people who, especially at young age, when they get a transplant done, they get a transplant in the frontal area, and then they go for lower hairlines, and when they thin out later on, they start, in fact, many a times they are put on finasteride or sometimes even dutasteride. And when they uh, you know spend some 2 3 4 years in this journey, sometimes they see that the medicines have stopped working, and but the hairline which they had actually created went very low. So Elon Musk, another thing which you can learn from Elon Musk is he did not go all out because he wasn't very sure how his hair loss is going to progress. So he went for a conservative hairline during his first procedure. And when he saw that everything is under control, he brought it little down. And that's what we can expect from a person like Elon Musk. He obviously he plans for so many things, and he must have planned for his surgery, and that is the way I would have done it perfectly the same way. Don't go for flashy hairline. This is your resource, use it thoughtfully. Don't go for flashy names of treatments, but go for the real substance, the real procedure. I got FUE done, but I have my reasons to get FUE done. So one shoe doesn't fit all. So one procedure is obviously not good for everyone. One medication, and that too at a fixed dose of 1 mg per day, is not good for everyone. So just a small tip to finally summarize it: hair restoration is a journey. It is not one point destination. It is not one shot glory. You can learn it from Elon Musk, the way he planned his journey, uh, using the technique, which was FUT. Twice he got it done. He did not go for a flashy hairline. He went for a conservative hairline during his first procedure. That really makes sense. And as far as medications are concerned, there are speculations whether he's taking the medicine called finasteride, Propecia, or not. I personally believe that he is not taking any medicine. His hair loss got stabilized, and it can get stabilized in so many people. Even at the age of 46, I had a slight recession which I filled, and rest of my hair are pretty good. So use all these resources thoughtfully, the way Elon Musk did it, and we can learn otherwise also a lot from him. And I really love Elon Musk. Thank you. And those guys who really want to know something about transplant, any questions you have, please ask in comment section. As we get time, we'll answer those questions. And if you want to plan your journey with us, you can contact me at the given numbers and fill the contact form given in description.